Bismillahirrahmanirrahim. I'm talking on the physiology of the thyroid gland, and I'm talking on the degradation. Now, please note it. Drugs that inhibit the deiodinases are as follows: steroids, beta blockers, thiamide, and amiodarone. Amiodarone. These are the drugs: steroids, atenolol tablets, beta blockers. These are the carbimazole, thiamide, and these are the amidarone, hydrochloride, amidarones. These four groups are drugs that inhibit the function of the 5' deiodinases. What it happens? It means that they are not going to deiodination. They are not causing deiodination. T3 versus T4. इनका comparison देख लें please. Triiodothyronine 300 more times more active than the T4. The thyroid gland only produces about 10%. T3, the rest is made from the peripheral kidney or the liver conversion from the T4. Only 0.3% is unbound and free for use in the body, stored in the thyroid follicles until needed. Thyroxine, inactive thyroid hormone or prohormone, you can say, 80 to 90% of the thyroid gland production, most of which is converted into T3. Only 0.03 is unbound and free for free use in the body, can also be converted into reverse T3, which is inactive and stored form of the hormone. This conversion can be seen most often in patients taking too much T4. Ratio of T4 to T3 is 5:1 in circulation, and potency of the T4 to T3 is 1:10. Affinity. Mechanism of action. Receptors for thyroid hormone action are intracellular DNA binding proteins. This should be very much known. Receptors for thyroid hormone actions are intracellular DNA binding proteins. Function as a hormone responsive transcription factors. Mode of action is similar to the steroid hormones. T3 binds to a short repetitive sequence of a DNA called thyroid response elements, TRE. TRE DNA sequence, that is the AGGTCA, these are the codons, can be arranged as direct repeats. Palindromes or inverted repeats can be monomer AGGTCA, homodimer AGGTCAAN, or a heterodimer T4 plus another protein complex with the retinoic acid receptor and other member of the nuclear receptor subfamily. These are the nuclear receptors which are present in the nucleus and by which the action of the T3 and T4 is made possible. Heterodimer is the high affinity form and thought to be the major functional entity. You're looking here. T3 attaches to a special sequence, monodimer, alpha and beta. T3 and T3, well, you're looking here as a homodimer, alpha alpha, alpha beta, alpha beta. T3, it also heterodimer. This is so they come and attach to DNA sequences. You're looking here, mechanism of action of steroid hormone. This is another steroid hormones. There comes receptor proteins, then hormone protein receptor complex, and they act on the DNA. The plasma membrane of a target cell. ये steroid hormones का दरमियान में मैं आपको बता रहा हूँ कि how they cause their effects, biological effects, metabolic effects. Steroid hormone come, this is the receptor, key lock position, then it comes here and it attaches to the hormone receptor complex on the DNA. And now as a result of that, messenger RNA is formed, they go into the cytoplasm, then plasma membrane, and they cause the various protein formation. See, mechanism of action of the thyroid gland, you are looking here. Thyroid gland, transporter, ये खारिज हो गए सेल से, these are the, ये खारिज हो जाए सेल से, कहाँ जाएंगे? ब्लड में, and they will be going, yes, ये ब्लड में से यहाँ से आए, फॉर्मेशन के बाद यहाँ पर आए, और यहाँ पर they are coming by the transporters into the cell, and then cytoplasm, they attaches with various receptors and they go into the nucleus where they attach into the DNA, and then the messenger RNA comes and which form the various proteins which are the mediators for the action of the thyroid hormones. This is very much complex, you should be knowing. Physiological effects of the thyroid hormones. Effects include increased ATP production, number one, very much important. Increased cellular metabolism, energy utilization and oxygen consumption. Increased body temperature, BMR is increased. Growth and development of skeletal, muscular and nervous system in fetus and children. Systemic effects are as follows on CVS, very much important. Increased heart rate, increased force of cardiac contraction, increased stroke volume, increased cardiac output, upregulation of catecholamine receptors, thyroid gland, thyroid hormones. Then while you're looking, inotropy and chronotropy, these are the terms for the force of contraction and for the rate of the heart contraction. Inotropic effect है and chronotropic effect है किसके? Thyroid gland, thyroid hormones के heart पर. You're looking here, cardiac output is increased and stroke volume is increased. Respiratory system, increase resting respiratory rate, increased minute ventilation, increased ventilatory response to hypercapnia and hypoxia. While kidneys, you're looking here, increased blood flow, increased glomerular filtration rate. You're looking here, thyroid gland, thyroid hormone, heart, inotropy, chronotropy, increase the cardiac output, blood volume, blood pressure. And if all is increased, then renal blood flow is increased, then sodium reabsorption is increased, GFR is increased. And you're looking here, thyroid hormone cause the blood vessels increase. The nitric oxide activity, renin-angiotensin mechanism. You're looking increased blood flow, increased glomerular filtration rate, nitric oxide, which is a vasodilator, and systemic vascular resistance. RBCs, oxygen consumption. Well, increased RBC mass, increased oxygen dissociation from hemoglobin. Thyroid hormones cause an increase in the oxygen consumption through following action: increased mitochondrial size, number and key enzymes, increased plasma membrane sodium potassium ATPase activity, increased futile thermogenic energy cycles, decreased superoxide dimutase activity. Intermediary metabolism, increased glucose absorption. Increased glucose absorption from the gastrointestinal tract, increased carbohydrate, lipid and protein turnover, downregulate insulin receptors, increase substrate availability. Growth and tissue development. Many of the thyroid hormone effects on development are mediated via growth factors, including somatomatins, erythropoietin, nerve growth factor, and epidermal growth factors. Increased growth and maturation of bone, increased bone development, the tooth development and eruption, increased growth and maturation of the epidermis, hair follicles and nails, increased rate and force of skeletal muscle contraction, inhibit synthesis and increase degradation of mucopolysaccharides in subcutaneous tissue. You're looking here. Well, this is the pituitary gland, pituitary